In this video, we will talk about the V4 right-sided lead placement. In the previous videos, we talked about how we can record the right-sided EKGs for right-sided pathologies, but we found that the most useful lead is actually V4. Only V4 that is really very important to detect right ventricular infarction. So what we can do is actually placing all leads in the usual placing method, except for the V4. Instead of its place on the fifth intercostal space on the left side, we get it back to the fifth intercostal space on the right side, okay, at the midclavicular line. This is called V4R. And this is really very useful to detect ST segment elevation for diagnosis of right ventricular myocardial infarction with sensitivity of almost 90% and sensitivity of 80%, and overall diagnostic accuracy of almost 80% as well. So it's really very useful to especially if a patient having a chest pain and you don't want to do a different EKG and replace all the EKGs, the leads to the right side, you can just take the lead 4 and put it to the right side. And in this case, you will have V4R that can help you diagnose right ventricular myocardial infarction.